Hello everyone, this is Jeff. I'm going to do a video that's going to go through our new Kinnser system specific to the PT evaluation. So when you first log in, you're going to, first thing you always want to do is go to your hotbox, and that's where you're going to see patients that have been assigned to you and the tasks that the scheduler has assigned to you for that day. So as you can see, today I have an evaluation to do on Allison Plummer. And before we get directly into this, a couple things I want to point out is as you get into this and you have questions, one place to look before calling the office to ask for help is click on this Need Help section. And there's a number of training things that can help. One that I want to point out that's going to help with the eval, if you click on Need Training, and then over here on the left, you're going to go to Training Series for Clinicians. And if you come down Training Series for clinicians to manage progress to goals. That's abbreviated PTG. You'll hear that throughout me talking. If I say PTG, I mean progress to goals. There's a 55-minute video here that you can watch that will take you through kind of how to do the PTG or the progress to goals and how to update them on your daily notes. That's definitely the hardest part of this new system. The rest is pretty self-explanatory and similar to what we were doing before. So let's go ahead and get into this. I'm going to click on the patient's name. It's going to pull up the PT evaluation. I've already started working on this, so a lot of stuff's pre-populated. I'll kind of talk you through it as we go. You're going to confirm the patient's identity. We're using military time, so make sure you do that. You can make sure to put in a date and ignore the associated mileage and ignore your documentation and travel time. Unless it's really important to you, you can put that in, but I don't think the agency is going to care. As you go down here, the medical diagnosis likely will be pre-populated by the office. If not, go ahead and type in what you think the medical diagnosis is. In this case, it's easy. It was a right TKA. And then I'm going to go ahead and type in what my PT diagnosis is. And I did decreased strength, range of motion, her gait and balance. You're going to make sure you put it as the onset and pick today's date as the onset date. You put in past medical history that you can get from the patient's chart or talking to the patient. Obviously, their prior level of function and goal, prior level of function is similar to what we did before. This will also give you a chance to put in their precautions. This patient doesn't have anything specific except weight bearing is tolerated and TKA precautions, which aren't a lot, right? Just be careful. The patient goals is a new thing for the Medicare COP that we want to make sure we're asking the patient what their goals are. And you don't need to be real specific in this section because as we get down farther doing the PTG, we'll have an opportunity to be specific. But you do want to put in what the patient wants to get out of therapy. Obviously, homebound is important. Check the boxes and type in any additional information of why it's a taxing effort to leave home and why the patient is homebound. I put that they can't drive and they're on narcotic pain meds. You'll have an opportunity here that was not in Devero to put in who the patient's living with, what kind of help they need. So if this patient lives alone, for example, you'll have an opportunity to talk about that, why they may need more care. You can also talk about their home safety setup, giving you a box for that, which I like. So an opportunity to put in stairs or their home environment. You know, I said here they have a big energetic dog. The vital signs are very similar. The one difference you'll notice is that it does give you an opportunity to put in pre and post vitals. You only need to do one. On the treatment notes, it will also say during, which I like. So if their heart rate increases significantly with an intervention, for example, you can write that in, which I like. Obviously subjective, we don't need to go over that, but it'll just give you an opportunity to talk about what the patient hopes to get from therapy. And I put here, like for example, that the patient wants to go to outpatient within a few weeks, so that was important information to put on there somewhere. And this next section is pretty straightforward in their physical assessment for these different body systems. This is where I took an opportunity to say the patient has hearing aids, large surgical incision, that they fatigue quickly, and that they have diabetes, so they have some neuropathy in their feet. Also can note the edema. It does give you a place if you're taking circumferential measurements, so you can refer to those in future dates. I do like on this pain section, it gives you a secondary site. So this patient also was having some back pain, so I put in back pain, but it's not nearly as severe as the knee, so it's easier to break up. And I like that this will carry over to your treatment notes, so the increase by, relieve by, and interferes with will carry over, which was a time-consuming thing on the Devero notes. However, make sure you're looking at that each time if it carries over, that it's still applicable, and that you're updating the pain intensity and changing it as the patient progresses or degresses, obviously. If no pain reported, obviously you can put that in here. This section for the range of motion will carry over, which is nice because it's kind of time consuming to put in each time. One little time saver that they have put in, for example, if their dorsiflexion is fine, or their ankle motion, when you type in within functional limits and hit tab, it will pre-populate all of those if that's what you want it to do. If not, you'll have to go in and change those. One other side note I should make here, because you could also type enter when you do that. Each time you hit enter, it's going to save for you, and I should have said that at the very beginning, that is one thing that's different here on Kinnser than you'll find on Devero. It does not save automatically. It does not. So you have to come down to the bottom and hit save frequently, or if you're in any box that's a text box and hit enter, it will also save for you. I'm getting a warning error because I also have a treatment note for this same time today that I'll show you guys in a minute. So obviously you wouldn't do that, and you wouldn't get that error in a real life scenario. But pay attention to those boxes because they're there to help you. So after the range of motion, we'll have this functional assessment section with the associated supervision or help that they need, assistance that they need. So you can do that for bed mobility, gait, transfers, and wheelchairs. It'll give you an opportunity to type in their assistive devices or any weight-bearing status or precautions, as well as balance. On this section, fall risk and other testing is where you'll have the opportunity to type in each functional test that you do. However, one thing I want to point out is if you want to do 2 tests for the same system, such as balance, you will have to put it in a different section, unfortunately. So for example, with WOMAC, there's nowhere it really fits, so I just put it under the balance and confidence section and typed other. Sorry for that. Let me get back to where I was. Typed other and typed in WOMAC and the associated score. So for example, if you did a timed up and go plus a dual task timed up and go, you could put that under cognition. And the next section will be your durable medical equipment. And then this is where you'll have the opportunity to do your clinical statement. So patient is TKA, presenting with impairments, blah, 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 and their need for skilled needs. So this next section, your treatment, PTG is what we refer to. This is where you're going to do your goals and your interventions, and this is where the bulk of your your time for your evaluation is going to be. So let's go ahead and put in a new goal for this patient. Again, I'm getting a warning just because of that overlap. But as you go in here, so let's go ahead and make a new goal for this patient. You'll see I already have some in. You'll also be able to see what other discipline goals are, so nursing or OT, whatever. So I'm going to do a new goal, and I'm going to be redundant here with this just because it's an easy one. So we're going to go do gait. So as you scroll down to bed mobility, transfers, fall risk, strengths, gait speed, whatever you choose to do. So let's go with this gait goal, and one thing that it will do is attach your interventions right here. So each goal is going to have attached interventions. Sorry, my kids are being loud in the background, so I was a little distracted there for a minute. As you go, you're going to want to type in the target date. So if the patient's only going to be on for a few weeks, I'm going to do this as a 1-week goal. That's a short-term goal, and the patient is going to improve. And we're going to want to say their gait capacity is evidenced by the ability to ambulate with their front wheel walker with independence for, and I already typed this in, that's why some of this is pre-populating, 150 feet to allow patient to walk from kitchen to bathroom within 1 week. And so that's the goal. But now here's the interventions that are pre-attached. So you don't have to use all of them, but you're going to want one or more intervention for each goal. And so you can take ones off right here if you choose not to use them. But for example, we're going to provide education to caregiver, and I'm just going to include and patient right here to the caregiver and patient regarding, and I'm going to say fall prevention, proper use of walker, to address gait and safety concerns. Thank you. And then as you're going here, for example, you have other education ones. I'm not going to do another education intervention for this goal, but I am going to provide gait training. And what is that gait training to be focused on? So this is where you enter patient-specific interventions. So I'm going to talk about, I'm going to do some pre-gait training. I'm going to work on gait mechanics. I'm going to work on range of motion during gait, and any other specific intervention. So this is where I don't love this part because it makes you word find, and then this is where you're going to address what specific impairment. So I'm just going to put their gait impairments and fall risk. I'm not going to be real specific, but you could put, their decreased knee flexion during swing phase or something like that, for example. You could write on there. Sorry, my typing is not great. Okay, so the next thing, my goodness, flexion. So we're going to then assign that goal. Let's take off these other two interventions because we're only going to have those two assigned to that right now. So we'll go ahead and assign that goal to the patient. So now we have two interventions assigned. You can now have the opportunity to say whether you've completed that intervention, and you'll have this opportunity each time you do a treatment note or performed it. So today we performed some education. So I'm going to say performed. So we educated the patient and the caregiver. They still need some reinforcement. They didn't totally understand it. So we're going to write right here that education provided and ongoing need, and that patient educated with written materials for fall prevention, because I gave them a handout. So, and I'm going to hit submit. So you'll see here now it says 1 that I have been working towards that goal. So you guys are going to have to play with this. Just spend some time doing that and you'll get it down. And we may go in and adjust some of the interventions so it's easier, but I haven't done that yet. So then you hit return, it will bring you back here, and if you scroll back down to that section, you can see that now some of your goals and interventions are showing up, all the ones that we did. You can also comment on them here of if you need to make any clarifications or updates. The next thing that's really important is making sure you're doing your care coordination. Here I coordinated with the PT and also the nurse. Type in the name of the nurse, and then the what you talk to them about, obviously, is just like our other one. Your statement for rehab potential, and then this is where you're going to set your frequency. So the current episode is there, and then I typed in my frequency. Make sure that we're using a single number. So I'm going to see them 3 times a week for 2 weeks, and then the scheduler will go put that in. And then this is where you type your discharge plan. This patient's going to go to outpatient when they get MD approval and when they've met their goals. And then make sure that each time you include electronic signature before you submit this. So I'm logged in under someone else, so I'm not going to do an electronic signature, but you'll be prompted each time to create a signature and then to do it. And I think it only has to be 4 characters, so it's pretty easy. This approve button you'll never use. Return you'll use if they send a note back to you and you need to send it back to them after you made corrections. Today all we're going to do is save. So, and we'll continue. So that's the PT eval. Hope that was helpful.